Now going on to sixth question. So here we have a 45-year-old man with Crohn's disease. Whenever you see a question with Crohn's disease, it'll be an easy question. Trust me. So you should be happy. Whenever you see a Crohn's disease question, you'll be like, yay, I know this. Because in your FA, there are two tables comparing Crohn's disease and ulcerative colitis. If you know each point in those, you can solve any Crohn's disease, any ulcerative colitis question. Okay? Right. Now going on. So a 45-year-old man comes with Crohn's disease. He's with Crohn's disease, comes to the physician because of a 1-week history of dysuria and urinary urgency. Okay. So we have Crohn's disease and we have urinary symptoms here. Kind of don't match. We'll see what goes on. He has been treated for urinary tract infections twice in the past 6 months. Okay. He's currently taking infliximab, which is a very typical therapy for Crohn's disease. It's a monoclonal antibody. Okay. Now, cystoscopy shows pear-like plaques on the bladder wall. Biopsy of this lesion shows a focal layer of stratified squamous epithelium with hyperkeratosis. If the patient's bladder finding is caused by a vitamin deficiency, which other following features is most likely to be seen? So this is a vitamin deficiency question. Let's go to the options. Oh my God, the options are amazing, right? Carpopedal spasm, perifollicular hemorrhage, nystagmus, photodermatitis, circumcorneal neovascularization, night blindness, and intracranial hypertension. Now going on to what is important in this question. So like I said, Crohn's disease was the most important giveaway here. And directly from Crohn's disease, they just moved on to urinary symptoms. So pear-like plaques on the bladder wall, that it should tell you they're talking about squamous carcinoma in the bladder wall, right? Which is not actually very common. Transitional cell carcinoma is common, but okay, no problem. So they have also given stratified squamous epithelium with hyperkeratosis. So this tells you it's some sort of metaplasia, doesn't it? What is a normal epithelium in the bladder wall? It's transitional cell, correct? Now, if showing squamous cell, that means it's a metaplasia. Metaplasia, the word metaplasia and vitamin, it should integrate and tell you they're talking about vitamin A here. Okay. Now I'll tell you similar metaplastic conditions are seen even in your bronchi. Excessive smoking, columnar epithelium sheds off, becomes squamous. What is the aim of the body when it becomes a squamous epithelium? What is the body trying to do? The body is trying to withstand the stress, right? Okay. So that is why it becomes squamous epithelium. Even here, he's having dysuria, urinary frequency, and continuous UTIs. That means there's a lot of irritation in the bladder wall. That is why the bladder wall is going into metaplasia, correct? So that is one thing. Similar condition is seen even in Barrett's esophagus, right? Okay. So whenever you read such questions, immediately you should revise all the metaplastic conditions that are relevant to step 1. Okay. Now, coming to our question. So we have squamous. So we are talking about vitamin. And like I said, metaplasia vitamin should tell you vitamin A. So vitamin A, look at this, night blindness. That's it. Most of the times they'll give you night blindness because that's the earliest manifestation of vitamin A, right? And you have other conditions like xerophthalmia, Bitot spots, keratomalacia, right? And these are the typical vitamin A deficiency symptoms, right? Now look at the other questions. From this, you can learn most of your vitamins. Carpopedal spasm. Carpopedal spasm, very typical of hypocalcemia, vitamin D deficiency. Okay, so and perifollicular hemorrhage, very typical of vitamin C deficiency. Nystagmus is B1 deficiency seen in Wernicke encephalopathy. If that was your answer, you 100% have some alcoholism mentioned in the question. 100%. They want B1 deficiency with alcoholic patients, because ultimately when you're a doctor, you're going to treat that condition. You will treat an alcoholic patient for B1 deficiency. So you should know what are the symptoms of B1 deficiency in an alcoholic individual, which is Wernicke encephalopathy, Korsakoff psychosis, wet beriberi, dry beriberi. Dry beriberi is related to CNS, wet beriberi related to CVS. All these are typically seen in B1 deficiency in an alcoholic patient, correct? Wernicke encephalopathy is the most earliest manifestation. So nystagmus is a part of it. Okay. Photodermatitis. This is a giveaway for niacin, which is your B3. The 4Ds or the 3Ds, dermatitis, dementia, and death. And one more is diarrhea. Dermatitis, dementia, diarrhea, and death in very severe cases. But by then we'll treat the patients. So that is what they're talking about here. B6 deficiency if it's there, trust me, they should have given you something about carcinoid syndrome, where excessive serotonin is formed. So all your niacin is used up in forming serotonin. Basically, the tryptophan is used up in making your serotonin. Such type of conditions, right? They should give you somewhere the niacin deficiency is caused, because tryptophan is what forms niacin. So we should have, or you can have a combination of B2 deficiency with B6 deficiency. That's why they'll mess up with your brains with easy questions, right? Next, coming to circumcorneal neovascularization seen in B2, riboflavin, where you'll also see cheilitis, stomatitis, glossitis, seborrheic dermatitis, and circumcorneal neovascularization. These are the kind of things you'll see with B2. Also, you will see normocytic normochromic anemia. They can merge hematology and biochemistry and give you a question like this. You'll be always wondering where the hell, how can B2 cause normocytic normochromic anemia, right? So this you will understand when you solve many questions. Okay, you'll understand how B2 is used up, where B2 is involved, right? Next, intracranial hypertension. That's an interesting option. If you see all from A to F, they're all deficiency syndromes, but G, we're talking about excessive, that is toxicity. I am not sure how many of you over here have gone through your biochemistry. In that, your vitamin deficiency is vitamin A, clearly mentioned toxicity. You have something called pseudotumor cerebri, which is nothing but another word for intracranial hypertension. You learn a similar thing in your neurology as well, where you learn a young female who's obese, nulliparous, right? They present with sudden onset headache and all. That is a typical present of intracranial hypertension. But one more association of it is seen in vitamin A toxicity. You'll see intracranial hypertension and other symptoms, which you can go through in the book when you study. We're not touching that right now. So the focus on this question was, I didn't mention one very important point. Why are we even having vitamin deficiency in Crohn's disease? What is the relationship? The relationship is Crohn's disease is a malabsorption type of a disease in the body. Malabsorption of fat and everything. So what happens here? So your fat soluble vitamins are not absorbed. So what are your fat soluble vitamins? A, D, E, K. Correct? A, D, E, K are your fat soluble vitamins. So they have mentioned D in your first and A in the F option. The other things are all water soluble vitamins. Correct? Yeah. So here we are talking about fat soluble, which is seen typically in malabsorption. A similar question they could have given with intestinal sprue, topical sprue, something like that. Or they could have given some sort of ulceration. Even ulcerative colitis could have been given. And they could have confused you more by giving all the symptoms of Crohn's disease and ulcerative colitis and the drugs and some side effects of the drugs. And the end, it'll be what will be the vitamin deficiency seen in this patient. Okay. So it's an easy question, but they would have wasted your time royally, isn't it? So that's what, and what do we learn here? This is a memory based answering. Like I said, of course, it's conceptual. All your step one questions are conceptual, but what exactly we're targeting here is your memory. They're testing your memory in this question. They're testing, do you remember your vitamin deficiency questions? Do you remember what are the symptoms and signs you see? That's what they're testing here. Okay.